Hi everybody, I just got home a little bit ago. I hope that you're able to see me sitting here. Our light is not very good here in our bedroom. But I'm in here because Miss Willow barks when I try to do a video wherever she's at in the house. So I wanted to do an update on my mom. Bless her heart, you guys, I've never seen anyone in that much pain before. Very, very severe pain. So the hospital that she's at, they kept her last night and kept her on pain medication. And when I got there this morning really early, and they were keeping her pretty much at an even keel with her pain. She was able to stand it as long as they gave her her pain medication, right when it was ready, or she would really be in bad pain again. So let me tell you a little bit of what happened today. We started noticing that, yes, of course, her knee was swollen, and they were thinking that if it was infected, that it would have been all red and it would have been hot to the touch. So Mom's was just, a little bit hot, but not what you would expect. And the top of her knee and everything was swelled, but the redness was underneath of her knee and all the way down her calf, that whole back of her leg, and up above her knee a little was real red. And it almost looked like it was like a welt, And so they, of course, were doing all the blood work and, all of that stuff, and found out. So Mom has a bacteria in her blood. So what they're going to do is they sent away some of her blood to pathology to have that tested. It could take a day or two for them to find out which bacteria is in her bloodstream. Once they find out, right now she's on an IV antibiotic. And once they find out which bacteria it is, then they will change her to whatever antibiotic works for that bacteria. And she will have a PICC line put into her arm, and she'll be on the antibiotics through her PICC line IV for the next at least 4 to 6 weeks. That was very concerning. So she is septic in her knee. And so the surgeon took her down. Like I said, the hospital was busy. They had already had all their surgery scheduled and all that. So we waited. They told us it could be around 1 o'clock. They would try their best to fit her in if nothing else happened, in the surgery with other patients. So they ended up coming and getting her about 4 o'clock. And the surgeon came out and talked to us and told us that Mom's knee was full of pus and infection. And they cleaned all of that out. And that her arthritis is so severe that it has actually caused a gouge up in the femur bone, which is, up where, in the thigh bone, the femur. I think that's what, yeah, the femur bone. And it had actually gouged up to there. So Mom has a fracture in her knee bone, and her she has a tear in the left side of her meniscus, if I'm saying that correctly, and on the right side. So while the surgeon had her in there cleaning out that knee, he tried his best to take care of those tears. And we asked him if they would be taking her back into surgery, like for the fracture and for, the arthritis being severe. And he said that, in other words, they have to take care of one thing at a time, which of course makes sense. So they sent away the blood in her bloodstream, and they sent away the pus infection from her knee, and they have to find out Exactly. That is septic, though. We do know that for a fact. So my mom's knee was a mess. We didn't find out about the Baker's cyst that was about 4 inches um, wide on the back of her knee. I think that that was probably the least of their worries. I will say this much. My youngest sister Renee was telling me how God has answered prayers, because they said that my mom's knee has been that bad as far as the arthritis and the fracture, and how bad it is, severe how bad it is, that she's been living with that for a long time. And you guys, my mom is very strong when it comes to pain, and we knew something bad was wrong for her to be in that much pain. I've never seen anyone in that much pain in my life. It's been terrible. So come to find out, like my sister was saying, if my mom would have continued on at home, and the knee would have just been swollen, and it wouldn't have been red on top, and it wouldn't have been that hot. Without that pain, my mom would have just stayed at home. She would have probably passed away from the septic, from being septic, and that bacteria coursing through her body. So we are thankful that she had that pain, even though it was awful for her. Her blood pressure has gone as high as, what, 190, 195, over 80 something, enough to cause someone to have a stroke. And that part, is bad. But God made a way for her to just continue saying, I cannot live with this pain. Something's got to be done. And after the third time, they started seeing, wow, she had a line coming up from her leg where the infection has started to move. And they marked that off on her leg. I'm trying to think, because it was a long day today. I got there early, and then I left at 7 p.m. tonight. I had to take my insulin shot and eat something, Let me think here for a second. I know I'm probably forgetting stuff. I did say that, they're going to put that PICC line in her and hook that antibiotic as soon as they find out which one they need. She'll probably end up spending a few weeks in a skilled nursing facility. Her husband is not going to be able to take care of her because she can't do anything with that leg. When she got back from surgery, they did not even have her stabilized, which means her blood pressure was super high again, 190 over 87, I believe. The nurse was even upset. Why did they send her back to her room? And she wasn't stabilized. And she was in such pain. She was like twisting on the bed. It was heartbreaking. Chummy had prayer with her, and, I tried to get her to breathe, and she was, she was tight, all just clutching. And I was trying to get her to relax, and it's so hard when someone's in that much pain. You guys, it was heartbreaking. But they said her pain should slowly lessen, and that's our prayer. But yet it's going to take a little bit, because, cleaning those bones and stuff out was a lot of work and a lot of moving things. And, Mom's not in good shape because of the pain. So I think that that's probably maybe all I can remember at the moment. They did take pictures of inside her knee, and I'm going to post a couple of those. The first one I'll show you is how it looked in her knee. You're not going to really, it doesn't look gross or anything, but you'll see like One spot, I'll write on the picture, one spot that looks red, that's how inflamed and stuff it is. And one spot you'll see it looks cloudy, and that is actually all the infection. And then one spot you'll see where he got it all cleaned out. There's no cartilage in that knee. Not only, people say, well, I'm bone on bone. Mom, there's no cartilage. Nothing left in there. Her knee is in super bad shape. So, yeah, I'll leave a few of those pictures at the end so you guys can take a look at them, anybody that's curious. If you're not, you don't have to stay around to the end. They aren't gross pictures. They're just microscopic pictures, and kind of give you an idea of how bad it was inside. So, I'm praying and so hopeful that they'll keep her pain down tonight so she can get some rest. She was exhausted, absolutely exhausted. And I told her pain does that. Her heart rate, of course, was high. Her blood pressure was high because of her blood having an infection in it, a blood-borne bacteria. They did a echocardiogram of her heart, and that turned out good, which was a very good thing because that bacteria can damage your heart. So I was thrilled to know that test came back okay. So now if the antibiotics can get started again, the correct antibiotics, they should be able to keep that septic out of her, bloodstream, get it to stop. I don't know. I'm kind of just feel like I'm kind of going all over the place, but I'm tired. It's been a very long day, and of course full of worry. And I know we're not supposed to worry. We're supposed to give it all to God. And I tried. We all tried. But it's our mom. And hate to see anybody hurt, especially my mama. So I just wanted to give this update to everybody. Please continue to pray for her. And I hope that sooner than later we'll find out about that bacteria. And I will update you guys as soon as I find out anything new, or when they decide, what the next step is going to be. So thank you, and thank you for caring, and thank you for the prayers, and just thank you guys for being here for us. God bless you each and every one, and I'll talk to you on the next video. Good night.